much. Thank you all colleagues from the panel, dear colleagues, dear participants watching on site and online, dear organization, thank you very much for this invitation and the possibility to address a few words at the closing ceremony. Indeed, Licínio's video goes a bit toward the intervention I had planned for this panel, because indeed I am here to speak a bit about the European Health Data Space, which is a regulation that, as we speak, is being negotiated at the European Parliament as one of the co-legislators of the European Union. But going a bit behind, to introduce myself, I'm a medical doctor in the field of public health. I'm a researcher and also a policymaker, currently a policymaker at the European Union as a member of the European Parliament. And I'm used since my 12 years after graduation to get excited about the different information that high quality data can provide us, such as prevalence rates, incidence rates, prognosis, survival rates, but also about efficiency, DALYs, QALYs, you name it. Indeed, it is of the utmost importance that decisions are based on what the numbers say and what is the option that best leads to the common good. And with this conference and team, I would like to reflect a bit on what we are doing at the EU. And just to provide you a bit of a background why this European Health Data Space is so important. At the moment, we have that in the European Union, meaning 27 member states, 450 million citizens, we are, when it comes to health data, we are not in complete dark. We are in a room where only a few places are lit, and often we have to pay attention to where the light is shining on and who's lighting it up. And wouldn't it be fantastic to actually have a clear image on our mind about the space where we are? And this is what we are currently working on, to analyze, discuss, and negotiate this regulation that actually comes from the European Commission of the European Health Data Space, and to unlock the true potential of health data in the European Union. Very briefly, this regulation, or as I sometimes call it, this will be a revolution in the European Health Data Space, completely change the paradigm for all citizens in the European Union across borders. Because for the first time, European citizens will have access to their health data through their mobile phone in their own hands. And for the first time, they will live feeling that their health data is theirs and theirs alone, and that does not belong to the companies that keep it and store it. Actually, and what will this mean in reality? This will mean that it will not matter when you go to a health professional office. It does not matter if your health provider is on the public or the private sector. It's on Porto or it's in Warsaw in Poland, because the health data will be interoperable across the different spheres. There won't be any technological barriers and there won't be borders. This is what we are working on. So this will mean what? That if a Belgian patient will be able to have an appointment in France, a Portuguese patient will be able to have a second opinion on an imaging exam by a radiologist in Germany, or a patient from Czech Republic can go to the emergency room in Sweden. This already happens. However, what this regulation will bring is that all these doctors seeing all these patients from different member states will actually have immediate access to their medical record in their own language, already translated. So as you can understand, I'm quite excited about this because the potential and possibilities are enormous. Our priority working on this is on having citizens at the center of care and improving accessibility to healthcare. And for this is of the utmost importance to fully comply with the existing regulations, and throughout the whole process, we will guarantee that the patient consent will be a constant. So furthermore, I spoke a bit about primary use of data. I would like to just unveil a bit about the secondary use of data. This regulation will open the door for research as it has never been open before. And this will be a quite cherished treasure that is being talked about, because it will actually provide value to the high quality data access that this regulation will bring. This will impact the health field in different fronts and areas, such as development of new medical devices, to conclusions about the effectiveness of one screening method over the other, about the effectiveness of different drugs, and why not making better policy decisions that best meet the health needs of the population. So these will be decisions that save lives and improve life quality and well-being for all 450 million citizens in the European Union. So dear colleagues, with this, I finalize my intervention, and I would like to thank you for the work that you have developed in these 2 days, recognizing the importance to access high quality data and how it is essential for the functioning of what we are trying to build, which is a true European health union. As the second speaker here this afternoon in this panel stated, this is a road that nobody will make it alone, and everyone can contribute. And this will indeed be a treasure where the most precious asset is people's health, people's lives, and the future of the European Union. Thank you very much again for your invitation, and I wish you all the best for the future editions.